Good afternoon, seniors and my dear friends. I would like to talk to you about BLU, cobalt blue light unit, revolutionizing point of care diagnosis of corneal diseases. As we know, we stain the eyes with fluorescein stain, and if we have a photo slit lamp, we can take photos of the eye after switching on the cobalt blue filter. The blue light is emitted and then we can capture the photo. But what if you don't have a photo slit lamp? For example, in emergency ocular trauma, in ICU in chronic bedridden patients, in infants, if you want to photo document their corneal lesions, or in eye camps, you don't have a portable slit lamp. So how do you photo document these cases? So we thought to ourselves, what if we have an attachment for a smartphone that is low cost? Anyone, including doctors and MLOPs, any health assistants can use it. It should be portable, pocket-sized, and easy in handling. And the quality of the image obtained should be reproducible and good, and should tell us stain positive or negative images. So with this in mind, we opened up a slit lamp and we studied the blue filter in detail. After research and development in 2019, we developed the BLU first version, which was called as a BLU adapter. The details of which was published in IGO under the innovations, and it worked on the principle that a cobalt blue filter is introduced in front of the flashlight of a smartphone, which filters all the lights except the blue light, and which will give fluorescence of the patient's cornea. We used this to photo document an infant who had pseudomembranous conjunctivitis, and we could see how the lesion was healing with time when with treatment. And this was published in the IJMR. And in 2021, we came up with a blue patch. It was a bindi-sized small sticker type attachment that could stick onto the flashlight. And it was a disposable version. So whenever you want, you can stick it onto the flashlight, and you can take photos, just as you see here. But we thought ourselves, we want something that is more universal, more smaller, and cost-effective, and we want it to be reused. So in 23, we came up with this latest version of BLU, which you can see here. It follows the same BLU principle. It is made from acrylic material and is laser cut into precise circles. We take the BLU out of the packet that is provided, and then there is a sticking part which we peel off, and any smartphone, Android or iPhone, can be used. And you keep it on the flashlight, and with a gentle pressure, it gets stuck onto the flashlight. Now, after staining the patient's eye with fluorescein stain, you switch on your camera. You can use the regular video mode and capture photos through that, or you can go into the native camera mode itself. This is the video mode that is being done, and you can take with a normal photo mode, in which you can take the flashlight, the photo. This is a BLU photography. You can see the image that is being captured. This is a simple BLU photo. So these are the lesions that were captured using the BLU adapter attachment on the flashlight. And the pilot testing was done in 34 patients, and a 5-point Likert scale was used for user feasibility, and the images were graded by blinded subject experts, where 1 was best and 5 was worst. So 30 users said it was very easy, whereas the expert graders gave it 1 and 2 points. And we have received a grant from Seva Foundation, in which we have already implemented it in vision centers. We have taught sisters how to use it, and these are the images captured by the sisters. Sorry for the delay. So I believe we can train healthcare staff with minimized specialized training to use this device to supplement and promote healthcare communication and efficiency. It is a very simple, inexpensive, portable solution with a quick learning curve. Thank you.
What is the cost?
Right now, the cost we have come to is around 100 rupees, ma'am. We are trying to bring it down to 50 rupees.
Is it commercially available?
These are samples which I have given. We have not started selling it yet.
Okay.
The patent process is pending. So once the patent comes through, we are planning to make it commercially available.
Okay.
These are the samples which I have brought.
These are disposable.
It is reusable. So what we can do is the sticky part, the sticky film, we'll be providing multiple sticky films with this. So once you're done, you can take it off and then use another sticky film on it, and then you can stick it back. So since a sample, I have provided just 1 per piece.
Okay.
Pardon, sir?
How many times can we use it?
So it depends on the number of sticky films you have. So once you have it and you would replace it back, then it's just like we have not tested how many times
Yeah, yeah.
one film can be used, but we'll be providing at least 50 to 100 sticky films along with one packet itself. It is a very small, it is not expensive at all.
So if we take out the, I mean the films, the blue filters, can we take the normal picture with it?
Yes, sir.
Okay.
You can always use a phone as it is. Only when you keep this, you have to use, you can use it as blue photography.
Okay then.
The phone is left intact, no damage to the phone whatsoever.
Blue filter is polythene, no?
Pardon, sir?
Blue filter is made of what material?
So this one is made out of acrylic. The ones we have in the microscopes, in the slit lamps are made out of glass. But it's very difficult to cut glass into the small size. We have to grind the glass. It will cause breakage of the edges. So we have laser cut acrylic material to achieve the same effect.